Hi, welcome to another episode of the management of medically compromised patients. I've already mentioned the importance of knowing about the various conditions and how to deal with these patients so that one can actually prevent almost 90 to 95% of the complications that one can see in dental practice. So, today, let us continue with our session on medically compromised individuals. And myself, Dr. Epan Thomas, Professor and PG Guy, Department of Oral and Maxillofacial Surgery, Pushpiri College of General Sciences, Kerala. And today we'll be taking another one systemic condition or a systemic disorder, mainly something which is connected with our thyroid gland. Let us speak about the thyroid disorders and what are the problems associated. What is thyroid gland? What are its function? A little bit about the basic physiology. What are its pharmacological actions? Its interaction with the various systems and how is it being controlled? The levels is being controlled and what problems are we facing if we deal with a patient with the hypothyroidism or hyperthyroidism, and how to deal with some patients and what are the complications that we can face. Well, as you all know, thyroid is the largest endocrine gland in the body. It is located on the neck, okay, in the about the thyroid cartilage, and it has actually predominant functions. A main function is the secretion of two important hormones, that is T3, triiodothyronine, and T4, and that's what we call tetraiodothyronine or the thyroxine hormone. So these hormones are very much essential for various actions and functions of the body. So these two hormones are principally secreted by the thyroid gland, which is the largest endocrine gland situated on the anterior aspect of the neck. And the whatever iodine which is coming from your dietary intake is all being taken up by these thyroid follicles, and then they combine with this so-called tyrosine, and they form two major hormones, that is a T3 and T4. And what I told you earlier, it's about the triiodothyronine, that is T3, or a T4 is tetraiodothyronine or thyroxine. The tetraiodothyronine T4 is the inactive form. It gets converted to T3, and T3 is actually the active form of the thyroid hormone, which actually brings about predominant effects of the thyroid gland. Now let us see what the role of these thyroid hormones, how does it influence the body. Now it actually helps very much in maintaining the metabolic rhythm of the body. It's actually very much important for all the activities of the body. The cells turnover, the metabolism of the entire thing is actually based on these thyroid hormones. Their secretions control the metabolism of the human system. It also has got a predominant action on the growth and development. These two hormones are very essential for a normal growth and development, and disorders of this could be associated with the problems associated with the growth and the development of any individual. Then it's very important for the growth and development of most of the cells of the body, predominantly the brain cells. And if there is no adequate hormone, there can be deficiencies of that, and you can see the impaired brain growth and the associated signs and symptoms. It is very well required for the bone growth and even maintenance of the health of the bone also. So you have to be very much concerned about this. You have to know about all the actions of these hormones, how important and what an important role it has on all the systems of the body. And it also has a predominant action on the cardiovascular system, the renal system, as well as the respiratory system. So basically, as we have seen, now this is a predominant as one of the important hormone which has got predominant action secreted by the thyroid gland, influencing almost all the systems of the body, all the cells of the body. It's very predominant in the metabolism and the growth and development, and always, I mean, achieving maturity of all the cells with this predominant action on all these particular organs. Now let's see how are these particular hormones regulations, how secretions being regulated. Now in a situation, a normal individual, there is always a balance between the hormone and the control or the regulatory centers. Okay, so with all these particular system acts on something what we call as feedback system, the positive feedback system and the negative feedback system. Whenever there is an increased level of the hormone in the blood, when you want to reduce the level of the hormone, what happens? An inhibitory impulse goes. Whereas whenever there's a deficiency, when you need more hormone, there's a stimulatory effect going to higher center. Let's see how that thing works. Okay, in a situation where there is a deficiency of these thyroid hormones in the blood, so what happens? There's a stimulus, a positive stimulus, which is going on to the hypothalamus. Okay, the hypothalamus is the high command, of the main organ, which actually controls a lot of activities of the body. So a positive stimulus to the hypothalamus actually releases, a hormone called TRH, thyroid releasing hormone, and that acts on the anterior pituitary. Okay, this anterior pituitary is another one very important vital organ, which actually has got a pivotal control in the mechanism of various endocrinological orders. Now, this anterior pituitary again releases TSH, what we call as a thyroid stimulating hormone, which is secretion and which comes and stimulates the thyroid to secretes the amount of thyroxine. So that goes into the blood and the levels are met with. So this is what happens whenever there is a deficiency of thyroid. The stimulation goes to the hypothalamus. Hypothalamus secretes TRH, or thyroid regulating hormone, which acts on the anterior pituitary, which releases thyroid stimulating hormone, and this thyroid stimulating hormone acts on the thyroid gland and releases thyroxine, and the levels are met with. Okay, I hope that's understood now. Now let's see in the reverse situation what happens when there is excess of thyroid in the body, when there is excess of your hormone in the blood, either because of an exogenous drug intake or because of some disorder of the gland, or disorder of some sort of a tumor of some gland which actually creating a lot of thyroid. So in such situations, whenever there is an excess of thyroid, what happens? Let us see. In this situation, unlike the other where was stimulatory, here it's going to be having a negative impact. Okay, a negative impulse goes to the high command, the hypothalamus. So what happens? The hypothalamus do not secrete any hormone to the pituitary gland, and indirectly there won't be any stimulus for the pituitary gland, and thyroid stimulating hormone or TSH is not released from thyroid gland, and hence the secretion of hormone to the blood is cut off. So that is how the regulatory mechanism, the negative feedback works. So whenever there is a level which is going high, you have a negative feedback. Whenever there is a level which is low in the blood, you got a positive feedback. So basically, there's a balance between these two regulatory mechanisms, which actually always maintains the levels of thyroid in the body. Now, this is how it's acting. Okay. Now let's see what are the effects of this thyroxine or thyroid hormones on. I've told you it's got action on almost all the system. Let's see what are the predominant actions of this thyroxine on cardiovascular system. It actually very stimulatory to the heart. It acts on the heart and brings about an increase in the heart rate, or the heart rhythm is increased. You'll feel a higher rapid rate of pulse or tachycardia in this type of patients is quite common. And that also increases the force of contraction of the heart. So myocardium, contracts at much faster rate and increased rate also. Thereby, there's an always increased cardiac output and increased stroke volume. Because I've told you earlier, patients who's having a hyperthyroid or the thyroid hormone actually has got its own functions on the system. So all these are actions on the CVS. Actually, the effect of thyroxine increases the heart rate, increases the force of contraction, and increases the stroke volume, and thereby there's an increase in the cardiac output. That is something what you have to understand. And it actually sensitizes, this thyroid hormone sensitizes the effect of catecholamines, your adrenaline and noradrenaline, which is actually secreted in the blood in response to stress, already have a stimulatory effect on heart. So in the presence of this thyroxine, the action is actually regulated, or is higher. So basically that's what I meant by the last point there. These thyroxine hormones, they upregulate or sensitizes the myocardium to the effect of catecholamines. So that's in brief about the action of this drug on the central cardiovascular system. Let's see what happens to the respiratory system. It increases respiratory rate, okay, more than the normal, and it's got a stimulatory effect on the respiratory system too. It also has got an effect on the mode of ventilation, and increases the response of your lungs to hypercapnia and hypoxia. A situation wherever there is a higher levels of carbon dioxide is called hypercapnia. A situation where there's a lower level of oxygen is called hypoxia. So the lung or the respiratory center response to these situations are also regulated by these thyroid hormones. So that is the effect of thyroid hormones on the respiratory system. Now let us see what are the thyroid disorders. What are the disorders associated with this thyroid gland? There are predominantly two conditions. One in which there is a reduced secretion of thyroid hormone, which we call it as hypothyroidism. And the second condition is an increased level of thyroid hormone, where we call it as hyperthyroidism. So these are the two situations of thyroid disorder, the hyperthyroidism and hyperthyroidism. And two other terminologies also I would like to bring to your notice in this particular scenario, that is primary disorder and secondary disorder. Both this hypothyroidism or hyperthyroidism can be primary or secondary. When I say primary, that means the disorder is actually within the your thyroid gland substance. That means the problem is connected with the thyroid gland. So that is when we call it as a primary disorder. If the disorder is associated with the thyroid gland and thyroid gland doesn't secrete your thyroxine hormone, we call it as primary hypothyroidism. If there is an excess secretion by the gland because of some tumor or something like that, we call it primary hyperthyroidism. Same way, if there is no problem with the gland, but it is by virtue of the secretion from the higher authorities and the pituitary or the high command, because they are continuously stimulating, and if the result of these particular hormones is high, it becomes a secondary disorder. So any problem or alteration in the level of these thyroxine hormones, if it is by pure virtue of the disorder of thyroid gland, is called a primary disorder. If the thyroid gland is normal, but if it's a disorder of the pituitary or the hypothalamus, we call it as a secondary. So that's about the thyroid disorders. Now let's see, move on to the next one. How do you now identify the most problem with these thyroid patients when they come to your clinic is we don't know actually what sort of a disorder they are, like whether it is actually a hypothyroid or whether it's a hyperthyroid, because most of these patients, they are not aware. They actually consult a doctor and doctor gives them medications, and then based on that medication they take and the thyroid is controlled. So they actually do not know whether it's hypothyroid and hyperthyroid. But it's very important for us to understand whether the patient is hypothyroid or hyperthyroid, because the problems associated with the hypothyroid patient in dental clinic and the hyperthyroid patient in dental clinic, both are totally different. The management is also totally different. So it's very important for us to understand whether the patient is suffering from hypothyroidism or hyperthyroidism. Now, how can we do that? We can make out on two or three reasons or two or three methods. How? One, we can ask some questions to the patient. So based on the signs and symptoms, you can understand whether the patient is having or suffering from hypothyroidism or hyperthyroidism. The second part is you can ask that medication history. What drug the patient is taking. Patient don't know what drug, but they use a list of drugs. So if you see the drugs, you can understand whether the patient is taking medication for hypothyroidism or hyperthyroidism. And of course, confirmatory by blood test. So you can identify these patients based on the signs and symptoms, based on the medications what they take, and based on the blood test and the thyroid function test. Okay, now let's see what are the features associated with hypothyroidism. If you want to know based on the signs and symptoms, you should be able to ask the patient or elicit these things. So hypothyroidism patient, what are the signs and symptoms? They have an intolerance to cold, because thyroid hormones are very much essential for increasing the cardiac output and hyperdynamic situation. Okay, the blood flow is always on the high, the heart is always functioning fast. So always there's a continuous blood flow in patient with hyperthyroidism. Okay, so in hypothyroidism, what happens? There is a reduced supply of the blood, there's a reduced secretion of the hormones, so peripheral vasculature, everything, and overall will be very cold. There will be actually patient will have can't tolerate cold because they don't have adequate calories production. This actually the energy required for these patients in increased metabolic demands is actually by virtue of the caloric metabolism. The caloric has to be produced. So when there is no calories produced, what happens? The body doesn't have adequate energy to bear this stress. So intolerance to cold is because of this hypothyroidism. There is reduced amount of thyroid secretion, so there is a reduced amount of calorigenic effect and the patient can't bear the cold. So intolerance to cold is because of that. Increased appetite. What happens now in these hypothyroidism patients? The metabolism of this thing is also affected. So they actually feels a little bit of always they feel like eating more and more, because there is the whatever the food is being taken is not being dissipated to energy. It's not been broken down to energy because there's no calorigenic effect. So the ill effects of the food and the whatever eaten remains in the system. Okay, so energy is not being produced from that. So what happens for energy? You have a mechanism, an urge, a feeling of hunger comes automatically because the source of energy for the body is from the food. So when the energy requirement is not happening, the body has got a tendency to eat more and looking out for more energy. That's why these patients have got increased appetite. Weight gain. Why? Because all the food what you eat is not being broken down. There's no calorigenic effect. They are not being utilized for energy. All the usual food in normal individuals, the intake is being used for energy, breakdown, and excretion. So what happens? There's no collection, there's no settling. Whereas in hypothyroidism, there is not much of a what you call calorigenic effect. There's not much of breaking up. There is not much of utilization of the food. So what happens? Whatever ill effects happens, and patient tends to gain weight. They put on weight. Memory issues. I told you thyroid is very essential for normal brain growth and development and all the connecting the activities. So whenever patients having a hypothyroidism, they have a tendency to have short-term memory, retention loss, memory issues, etc. Lethargy and fatigue, they always, because I've told you, they do not have a good system of energy producing, or calorigenic effect is not there whenever there is a reduced thyroid. So when the energy is not there, they'll feel lethargic and fatigue always. Hypertension and giddiness. Why? I told you, whenever there is a reduced amount of thyroid, there's a reduced amount of stimulation of the heart. There's a reduced amount of force of contraction. There's reduced cardiac output. There's reduced stroke volume. So end result is the circulating volume of the blood, and the pressure is also becoming less. So hypertension. Whenever there's hypertension and whenever there's no adequate blood reaching the brain and the vital structures, you feel giddy. So that's the reason for hypertension in this hypothyroidism patient. Constipation. Thyroid hormones are essentially required for your motility, the gastric motility. So whenever there is a reduction in the thyroid hormone, there is a stasis, there is a decreased gastric motility, and that is why in hypothyroid patients you will find this constipation as one of the complaints. Dry skin, again, dehydration happens and there's not adequate amount of nutrition reaching the skin surface, so you feel they get this dry skin appearance. So these are the basic signs and symptoms of patients with hypothyroid. This is basically a nutshell. Poor memory, I've told you the reason why poor memory, because brain growth is less. Hair thinning, because hair follicles are weak and they do not get retained and there's no adequate nutrition there. Cold intolerance and mixed edema, I've told you, because there's no calorigenic effect. And bradycardia, because of the inhibitory effect on the heart, or there is no stimulation on the heart. These are the, in nutshell, the features of hypothyroidism. Now let's see what are the signs and symptoms of hyperthyroidism. Okay, it's opposite side. There's excess secretions of thyroid hormones. Anxiety, because they always have this hyperness. Okay, the excess of hormones are secreted in the blood, and always hyper anxiety situation. The metabolism is very high, and the heart is always increased. Circulatory volume is increasing. The pressure is increasing. The force of contraction increasing. So all these give rise to, and the mental state is always irritable. The brain feels it always irritated, and this hyperactivity and hypermetabolism leads to all these situations. Diarrhea, because I've told you the hypothyroidism, there is a decreased gastric motility, but hyperthyroidism, there's an increased gastric motility, and that is the cause for the diarrhea. Skipped periods, again associated with other hormonal imbalances. They always tend to be more hyperactive, because I've told you they always are in a, their sympathetic act is always high, and these hormones are always stimulatory to the heart and always in a vigil state, and they'll be more hyper than a normal individual. Tremors, because the fine tremors happen because of the excess stimulation on the neurogenic substances, because of the excess metabolic activity, and that's the reason why you get these tremors, and because excitation of these nerves in the peripheral thing. And sweating, again, because of the excessive sympathetic activity associated with increased thyroid secretions. They are always warm to touch, because always blood circulation is always on the rise, on the high. So wherever they feel, they feel very warm to touch. Now these are the signs and symptoms of hyperthyroidism because of the excess thyroid secretions. That's in nutshell basically about hyperthyroidism. All these are features. Hypertension, because, and tachycardia, because they are always cardiac stimulant. So excess thyroid always stimulates the heart and always sensitizes the myocardium to the effects of adrenaline also. So all these are the reasons why you get these signs and symptoms in patients with hyperthyroidism. Okay. Now, based on medication, now we have understood, based on the signs and symptoms, how do you identify a hyperthyroid from a hypothyroid. Now let's see what are the medications. So based on the medication, how do you identify a patient whether it's hypothyroid or hyperthyroid? Remember, all drugs for hyperthyroidism, they will fall into any of these three categories. They'll have a combination of methimazole, propyl thiouracil, or carbimazole. It's used either individually or in combinations. So any drug preparations that the patient brings to you with any of these names like methimazole, propyl thiouracil, carbimazole, you should actually understand that patient is a hyperthyroid patient. Okay. Similarly, how to look for a hypothyroid patients. Now, all the drug preparations are basically synthetic forms of thyroxine. Patients who have hypothyroid will always have this synthetic thyroxine as supplements. Mainly, it's all about preparations of levothyroxine. Levothyroxine is a pharmacological ingredient, a synthetic substitute of the cell, what you call thyroxine, and that is a hormone which is actually condensed in this thyronome, L-troxin, and other preparations. So, if the patient is taking these preparations on your right, that is thyronome and L-troxin, you should consider them as hypothyroid. If the patient is taking any of these on your left, methimazole, propyl thiouracil, carbimazole, you should consider that patient as a hyperthyroid. Okay, that's how we identify based on the medications. Now, let's see what are the problems associated with hyperthyroidism. Okay, because whatever procedures we do, we create stress, isn't it? And we also give LA with adrenaline. So, these are two very essential or very harmful things for the patients with hyperthyroidism. How and what? Let's see. Whenever there is stress, there is large amount of adrenaline and noradrenaline or the catecholamines being released in the circulations. Catecholamines already have a stimulatory effect on the heart. So these hyperthyroid patients, what happens? The thyroxine sensitizes the myocardium to the effect of catecholamines. So they have a added effect on the heart. So in hyperthyroid patients, their heart is already functioning over time to meet this increased demand because of the increased metabolic activity. And on top of that, adrenaline is going to again stimulate the heart, making situation worse. Okay, what we call it as thyroid crisis or thyroid storm, exacerbation of hyperthyroid situation is the thyroid crisis or the thyroid storm. Overload to the heart happens, I've told you, because they're already having an excess workload. On top of that, whenever the stress induces more load, the heart undergoes a lot of excess stress, and then it leads to arrhythmias, where the rate goes beyond the normal thing, and after a long period of a continuous stress, then it goes into fibrillation, and finally patient go for a cardiac failure, and death is the end result. Okay, remember whenever using LA with adrenaline, this adrenaline can create trouble. I told you it's stimulated to the heart. So if the patient is hyperthyroid and if using LA with adrenaline, we should be very careful because adrenaline can cause a further stimulatory effect on these patients, and a hyperthyroid patient can develop a thyroid storm or the thyroid crisis. Remember that. So these are things that you should consider, the problems associated with hyperthyroidism. Let's see what are the problems associated with hypothyroidism. Now, hypothyroidism as such do not have any direct issues or problems with us. Okay, because they actually have the only problem is they do people with hypothyroidism are more for hypotension because the circulatory volume is less. Overall, the hypotension situation is there. Cardiac output is less. Stroke volume, force of contraction, everything is less. So they have hypotension. So the brain is vulnerable to hypoxia and they are more prone for syncope. So these are the only main situation what we are worried about hypothyroidism. Otherwise, hypothyroidism do not actually pose us any problem. Now, based on the test, how do you or investigation, how do you identify this particular patients with hypothyroid? Now, you have to look for patients' values. What are the values you look for? One is free T3, triiodothyronine. The normal value is between 100 to 200 nanograms per deciliter. T4 value is 5 to 12 nanograms or picograms per deciliter, and the free T4 value is 0.8 to 1.8 micrograms per deciliter. Now, if the values are more than this, as blood test values shows more than this, the patient has to be diagnosed as a hyperthyroidism patient. Okay, if the values are lesser than these, then it's called as hypothyroidism patient. So that is what I was talking about earlier. Third method of diagnosing the patient whether it's a hypothyroid or a hyperthyroid. Okay. TSH value also has to be checked in this patient. The thyroid function test includes all these three. Remember, in our situations, whenever we send these patients for a cardiological or a physiological or a physician's consent, they just take the TSH value or the thyroid function test, and they'll give us a fitness. But remember, we are more worried about this T3 and T4, because these are the hormones which is having a direct effect on the heart and stimulatory effect. So if the values of these hormones are high, then you better not take up the case. So that is something which I want to tell you all, a message which I would like to tell you all. Diagnosis, how do you diagnose? I've told you, based on the signs and symptoms, based on medications, based on the investigation values. So these are the values based on which you have to actually diagnose this particular patient with the thyroid disorders. Well, how do you manage? Physician's consent is a must. Okay, even though physician gives you fitness, make sure the patient's T3, T4 values are within normal limits. Patients actually, the physician, they take for this thyroid function test, and they actually take a measure of the TSH. So TSH value may not be always giving a confirmatory or a result regarding what we require. What we require is more about the T3, T4 levels. Okay, so that is actually what is going to create trouble for the heart. So even though the physician gives a consent, make sure that you have a normal T3, T4 test which you have got convinced based on the test, and then only proceed. So if the value of T3, T4 is high, even if the physician gives the consent, do not proceed with that case. That will give you trouble. Okay, so that is something which I want to put across. Then adopt stress reduction protocols. All the procedures which actually create stress for the patient. It induces secretions of these sympathomimetic agents, that is the catecholamines, and that we know it actually stimulates the heart. In a hyperthyroid patient, it's excess stimulation. Patient will go into thyroid crisis and thyroid failure. So stress reduction protocols has to be adopted. Both can either take pharmacological methods or non-pharmacological methods. Pharmacological methods include the use of anxiolytics and sedatives and hypnotics. And non-pharmacological methods includes the proper mannerisms, proper audio analgesia and other mechanisms in the clinical setup. Do an air traumatic procedure again to create or to reduce the amount of stress what is created. Procedure has to be done with a gentle care and gain the patient's confidence, make the patient feel at home, make the patient comfortable, and always do the procedure atraumatically. And the local anesthetic with adrenaline should be used with care. I've told you, in hyperthyroidism patient, as much as produced, this adrenaline will produce hyperthyroid crisis or thyroid storm. So a patient with hyperthyroidism, it's always best to use a plain LA. Or if at all you're using adrenaline, make sure you're using adrenaline in the concentration of 1:2 lakh. That means the maximum dilution adrenaline, which can create trouble. So if you're using LA with 1:2 lakh adrenaline and with a careful aspiration injection, your procedure is safe. But always remember, never take up a case of hyperthyroidism where the values are beyond normal. I mean T3, T4 values. If it's abnormal, do not treat under clinical setup. You can refer the patient to hospital setup where they can be managed in a better way. Hypothyroidism patient is not at all a concern for us. Okay, with that, we have come to the end of the session on hyper or hypothyroid diseases, and thank you for the listening. I hope it's clear now. We have actually discussed basically about the thyroid gland, its hormones, the functions, its effects on the various systems, what are the disorders of thyroid, how to identify a hypothyroid patient from a hyperthyroid patient based on the medication, based on the signs and symptoms, based on the investigations. And once you know the patient, how do you manage this particular patient in your clinic based on the values? What are the preventive measures or the protective measures that you should take? So remember these measures, and next time when you come across a patient, do use this information and treat the patient very well. And thank you for your patient listening.